So we were working with the Senate Finance Committee health staff under Daniel Patrick Moynihan. We realized that as the Clinton health care reform bill went through the process that we learned about, it would either be made or broken in the Senate Finance Committee. My role at that point was to look at the aspects of computers that the bill tried to address poorly, unfortunately. And so I spent a lot of time rewriting and creating a section for that bill called administrative simplification. The Senate Finance Committee had jurisdiction over the funding for Medicare. We could say, oh, we can make it more simple. We can lower the cost of health care through the government's use of administrative simplification. So the basic idea was to set standards for how health information is recorded electronically. And because we would be making people's health information electronic and therefore reproducible at zero cost in zero time, we had to set up protections for the security and the privacy of that information. Well, that health reform bill did not pass, finally. But other healthcare reform bills kept being offered by both Democrats and Republicans. And finally, one called HIPAA got passed in 1996. And my administrative simplification draft law was attached to it. So I became one of the fellows who had actually written a law that got passed. Now, that didn't happen until 1996. Well, Donna Shalala, the Secretary of HHS, decided that because they kept adding administrative simplifications to all the bills that were about to pass, she needed somebody who could write the regulations and implement the law that I had basically written. And so she somehow finagled with my dean that my sabbatical would be extended. And then when the law passed, the HHS decided I had to be there full-time as one of their employees working on the regulations to implement the administrative simplification aspects of HIPAA.